Hi guys, welcome back to my channel OMFS Classroom with Dr. Jhalak. So our next video will be on mandibular nerve. Yes, mandibular nerve. It is the third branch of trigeminal nerve. In last two videos we have studied about the first two branches of trigeminal nerve, and today we will start with the mandibular nerve. Mandibular nerve is the third branch starting from the ganglion. It starts as two roots. One is the motor and one is the sensory root. So motor and the sensory root, ये दोनों रूट्स ज्वाइन करके मैंडिबुलर नर्व की ट्रंक बनाती हैं, और ये दोनों रूट्स जो हैं फोरामेन ओवेल से बाहर आती हैं. द फोरामेन ओवेल दे एग्जिट थ्रू फोरामेन ओवेल, एंड व्हेन दे एग्जिट थ्रू फोरामेन ओवेल they form mandibular trunk. अब mandibular trunk, it is the branch, then it gives its branches. Branches are divided into branches of mandibular nerve from the undivided part and from the divided part. From the undivided part, it gives first branch, that is nervus spinosus, which passes up into the skull through the foramen spinosum to supply the dura mater. So the first branch of mandibular nerve is nervus spinosus. Number 1, it supplies the dura. Next, when it comes, it gives its branch to internal pterygoid. This is internal pterygoid. ठीक है, तो नर्व टू मीडियल टेरिगोइड दे दी इसने फ्रॉम द अनडिवाइडेड पार्ट. सो टू ब्रांचेस, नर्वस स्पाइनोसिस एंड इंटरनल टेरिगोइड और मीडियल टेरिगोइड ब्रांच. देन इट this is from the undivided part. Then it also gives its branches to the from the medial pterygoid nerve. It also gives its branches to the two muscles, that is tensor villi palatini and tensor tympani. These are the accessory muscles of mastication. So these two branches also arise from the mandibular nerve only. And then it divides into anterior and posterior division. So when it divides into anterior and posterior division, it gives from the anterior division, it supplies muscles of mastication. So it is very easy to remember the branches of mandibular nerve. First of all, we will learn undivided part, two branches. Number 1 is nervus spinosus, number 2 is nerve to medial pterygoid, which further gives branches to tensor villi palatini and tensor tympani. Next, from the divided part. From the divided part, it divides into anterior division and posterior division. So first, from anterior division, it supplies muscles of mastication. So for one muscle it has already given from the undivided part. Rest 3 muscles will be supplied through this anterior branch of the mandibular nerve. That is lateral pterygoid, masseteric and deep temporal. So 3 nerves, okay, and one more long buccal branch. So there are 4 branches of anterior division: lateral pterygoid, masseteric, deep temporal and long buccal. From the posterior division, and from the posterior division it gives 3 branches, that is lingual, inferior alveolar and auriculotemporal. So first of all, we will talk about auriculotemporal. Auriculotemporal arises as 2 roots. It circles around the middle meningeal artery and then it passes upward. It is associated with otic ganglion and it passes upward to supply external acoustic meatus, give its fibers to the parotid gland, to the terminal branches to the ear, pinna and auricular branch. So auriculotemporal, as the name suggests, it supplies basically the ear and it gives its branches to the parotid gland also. Okay, then Moving on towards the next branches of the posterior division. Next branch is the lingual nerve. It is the shortest branch of the posterior division of the mandibular nerve. Lingual branch, it supplies the anterior 2/3 of tongue. It is a sensory branch which supplies the anterior 2/3 of tongue, and the associated ganglion is submandibular ganglion. So it gives its fibers to the submandibular ganglion, and here some fibers to submandibular ganglion are received from the facial nerve, which gives it secretory special sensory fibers, that is cauda tympani fibers, which perceives taste sensations. So remember, in the nerve supply of tongue, only anterior 2/3 of part is supplied to the lingual nerve. This is a very important question from MDS first year and BDS final year students. That is, which nerve supply of tongue, which nerve supplies the tongue, which supply taste fibers are through cauda tympani, that is branch of facial. Lingual supplies only anterior 2/3, that is only sensory, and posterior 1/3 is through glossopharyngeal, and posterior most part is through vagus. So nerve supply of tongue we will learn, and this is a very important question, point to be noted. Then after that, branch to submandibular gland is through lingual nerve, and which also passes to give branches to sublingual gland also. And next, third branch of most important branch of posterior branch is inferior alveolar nerve branch. Inferior alveolar nerve enters the mandible through mandibular foramen, and it enters the bone and through mandibular foramen into the mandibular canal, inferior alveolar nerve canal, and it passes, before entering it gives one branch, that is mylohyoid branch, which supplies mylohyoid nerve and runs in the bone, in the mandible, in the mylohyoid groove. In further lecture we will study the surgical anatomy of mandible also. So for now you just remember that there is one branch, that is mylohyoid branch of the posterior division of mandibular nerve, which runs in the mylohyoid groove of mandible. So inferior alveolar nerve, when it passes into the canal, it gives its branches fibers through mandibular teeth, 8, 7, 6, 5, 4. Okay, then it divides here. In between there is mental foramen. There is mental foramen below the roots of premolars, and it exits through mental foramen and divides into incisive and mental branch. So mental branch comes out of the mental foramen, and incisive branch supplies the anterior teeth, incisors of mandibular teeth. So we come to know that mandibular nerve supplies all the mandibular teeth buccally. And what's the role of long buccal nerve? See, every long buccal nerve supplies the mucosa of posterior teeth, and mental nerve supplies the mucosa of anterior teeth, lip and chin region. So whenever we give block and we want to anesthetize, we need to keep in mind which nerve we have to block to supply, which nerve supplies which teeth, and which nerve we have to block for the extraction of a particular tooth. So this is very important and very easy. So in 1 minute we are going to revise the branches of mandibular nerve. Number 1, nervus spinosus. Number 2, medial pterygoid or internal pterygoid from the undivided part. Then from the divided part, anterior, posterior. Anterior 4 branches, lateral pterygoid, mesenteric, deep temporal and long buccal. Then posterior 3 branches. One is auriculotemporal, lingual and inferior alveolar, and one more branch, mylohyoid branch. So in nerve supply of tongue, lingual only supplies the anterior 2/3, gives its fibers to submandibular ganglion and sublingual ganglion. Taste fibers come through facial branch of facial nerve, that is called a tympani, and inferior alveolar nerve supplies is all mandibular teeth. It comes out through mental foramen by dividing into incisive and mental nerve. Incisive supplies the anterior teeth and mental nerve supplies the mucosa of anterior teeth, lip and the labial mucosa and the chin region. So guys, this is a very short video, very easy method to learn mandibular nerve. It is very important for all of you to remember this, because this is very important for exam point of purpose and for practical purposes also. Any doubts, kindly DM. Thank you.